Hi everyone. My name is Gaurav Goyal. I am an adult hematologist-oncologist at University of Alabama at Birmingham. I got interested in histiocytic disorders, including Erdheim-Chester disease, back when I was in fellowship at the Mayo Clinic. And we established a research program and then expanded it through multiple centers, including UAB now. And we continue to do research to advance the field and improve the experience and outcomes of patients and families living with ECD. Today, I'm going to talk a little bit about what we mean by survivorship, why survivorship research and survivorship as a whole concept is important for a disease like Erdheim-Chester disease, and then discuss about our ongoing study, the Histiocytic Disorder Follow-Up Study, which is, of course, in partnership with the ECD Global Alliance. So let's talk about what is survivorship and why do we need such a study to evaluate survivorship in ECD. Survivorship refers to the experience of living with, through, and beyond the diagnosis of Erdheim-Chester disease. It encompasses not only the physical aspects of managing the disease, but also the emotional, financial, and social dimensions that are being faced by the patients and their caregivers. From the moment of diagnosis, individuals begin a journey that includes treatment, recovery, and long-term health management, which also includes the side effects of the treatments. Survivorship also includes the support and involvement of caregivers, family members, and friends who play a crucial role in the patient's well-being. Understanding survivorship is essential because it highlights the need for comprehensive care that goes beyond just focusing on the ECD itself. By recognizing these multifaceted needs, the healthcare providers can offer more holistic and effective support for patients and families throughout their ECD journey. The need for a dedicated survivorship study in ECD, it arises from significant gaps in our understanding of the long-term effects of the disease or its treatment. Such studies are very well known in other cancers, like several blood cancers, like lymphomas and leukemias. But for ECD and other histiocytosis, these outcomes are unknown. Part of the challenge is that while the existing treatments have helped with improvement of symptoms and shrinking the lesions, ECD still continues to have these invisible manifestations such as fatigue, anxiety, depression, and cognitive or memory issues, which are not adequately captured in the clinical data that we have right now. The symptoms can persist often despite successful treatment, affecting the quality of life. It is hard to really develop guidelines to help with long-term care or to counsel patients effectively on what to expect in the long run without a comprehensive study. So our study aims to fill these gaps by collecting detailed information on chronic health conditions, psychological outcomes, pain, healthcare utilization. So overall, going beyond just what happens to ECD, but generally looking at what happens to the person experiencing ECD after the diagnosis. So this data will help identify the patterns, risk factors, and areas where interventions can improve patient outcomes. By participating in the study, you contribute to a collective effort to enhance understanding and support for the ECD community. Let's chat about what we have learned so far from our efforts, including the survivorship data, and why we need a large study of this magnitude to really address the question of survivorship. So far from our data, we have gleaned that patients with ECD experience a lot of chronic health problems. Example is osteoporosis, vertigo, high blood pressure, hearing loss, and so forth. We also found that many ECD patients experience anxiety, pain, reduced ability to participate in social activities, which are of course considered meaningful by the people, And in addition to that is difficulty with balance, which persists despite treatment. We also found that about a quarter of patients suffer from cognitive difficulties, meaning issues with memory, and that affects their daily life. Further, we conducted a large study analysis that found that there is significant reduction in physical health function as reported by ECD patients, which then affects the overall quality of life compared to general population. So this study is really going to the patients and asking them what are the health problems. So that is why these results are very important and valid, because they are not really interpreted by me or someone else. They are actually coming directly from you. But the question really is, why do we need large numbers? Achieving a large sample size in the survivorship study is crucial for generating reliable and generalizable insights. A larger participant pool allows researchers like myself to identify any patterns and any correlations across diverse patient groups, enhancing the statistical power. So it's not just enough to say, well, overall the health related quality is worse, but it's actually more important when you have a large sample size, you can further go deeper into it and figure out what is a common outcome, what is a rare outcome, what is the impact of different treatments, and then you can tailor follow-up recommendations for the individual patient based on that. Without sufficient data, conclusions are incomplete or they may be skewed. They may not represent everybody, and that they limit their usefulness in clinical practice because we will not be able to figure out who are the high-risk individuals for these problems. Therefore, I think widespread participation is not just beneficial, but I think it is essential for the success of this study. This empowers the community to advocate for better care and ensures that future guidelines are based on robust evidence, and it includes diverse perspectives from the patients and families. We'll talk about what is involved and how this study will help you and others. Participating in the ECD survivorship study is designed to be simple and accessible. Individuals are asked to complete a 45 to 60-minute survey. It has about 250 questions. This survey can be filled out online via a paper form that can be mailed to you, or even by a phone call where you can call and speak to one of the team members on our study team. And you can choose what methods work for you the best. The other important thing to keep in mind is that you don't need to travel. Everything can be done from the comfort of your home. When you're taking this survey, a common question I get asked is, you may not have the whole 1 hour at one time. So you can pause the survey and resume, even if you're doing it online later on, and it will store your information and you can pick it right back up later on. The survey covers various aspects of health, including chronic conditions, pain, psychological well-being, and quality of life metrics such as fatigue and anxiety, depression, and so forth. By sharing your experiences, you can provide valuable data that will inform future care. The process is, of course, confidential and respectful of participants' time and privacy. Engaging in the study is a meaningful way to contribute in the advancement of ECD research and to support others in the community who may benefit from improved care and understanding of these problems. Participation in the survivorship study has far-reaching benefits, both for the individual and the broader ECD community. The data collected eventually will be used to develop evidence-based guidelines for long-term care, helping healthcare providers like myself to offer more personalized and effective support. It will also enhance the understanding of the disease's impact over time, which is something I get asked a lot by the patients and families, leading to better management strategies and potentially new treatment approaches. For participants, it means improved quality of life and informed medical decisions. But at a community level, the study will empower advocacy efforts because you will have this concrete data that can influence policy making and funding. decisions. As this study is powered by the patient networks, it fosters a sense of solidarity among the patients and families, showing that your experiences are valued and impactful. Ultimately, this study is a step toward a future where ECD survivors receive the comprehensive and personalized care they deserve. Next steps, we'll review the numbers so far. How is the progress tracking going? And also we'll provide some instructions on how you can join the study if you're so interested in it. So we started the study approximately 2.5 or 3 years ago, 2.5 years ago with ECD Global Alliance support. And as of the latest update from last week, we have 151 participants with ECD who have completed their surveys. We are targeting about 300 participants. This highlights, this is an encouraging progress, but also highlights that continued engagement is really essential. So we are halfway there, but really need your support to get this study completed in a timely fashion. Each new participant brings unique insights that enrich the study's findings. So we need to really hear from everyone possible to come up with results that are meaningful. The enrollment data is being tracked and shared with the community through webinars like this, and I also share it with the ECD Global Alliance periodically, and we will continue to share it going forward. Reaching the target of 300 at least will enable comprehensive analysis and ensure that the results are representative of the entire community. The study also plans to include a comparison group of people without any cancer, especially ECD. That way we can compare what are the health problems that are occurring as a result of ECD and its treatments to issues that can occur normally as a part of aging process. The community involvement is really a cornerstone of this initiative, and every contribution moves us closer to meaningful outcomes. Joining the ECD survivorship study is straightforward and impactful. Interested individuals can visit the study website or contact us via email or phone number. There's a toll-free line. The information is provided at the bottom of this page, and I will also include this in my last slide for you to have. And this information will be available to you through the ECDGA as well. As I mentioned before, you can complete the survey online via phone, or we can mail it to you. Eligibility criteria are really everyone who is diagnosed with ECD and is English speaking. So this is important. So even if you are not from the US, as long as you're English speaking, because the survey is in English right now, you are able to participate in this study. The only thing we ask is that at least 2 years should have passed since the ECD diagnosis, so that patients are, they're undergoing treatments and whatever else they need to have done in the first 2 years, and they're truly in the survivorship phase. But if you call us even before then, we will take your information and reach back out to you at that 2-year mark. So anybody, we want to hear from anybody and everybody. The study is also open to other histiocytic disorders in case you know anybody with LCH, Rosai-Dorfman, and xanthogranuloma. They are eligible as well. Importantly, we really want to learn about the experiences of patients who did not do well also. So because that's really part of the goal, is to improve the outcomes of individuals who had any complication after ECD diagnosis. Because of that reason, we are actually encouraging family members of deceased participants who passed away after ECD diagnosis to contribute to the study as well. To acknowledge the time spent in the survey, we offer a gift card, which is only eligible, only people from the US are eligible for the gift card due to various regulations. But by taking part, individuals contribute to the vital research effort that aims to improve the care and outcomes for the ECD community. The process is really designed to be user-friendly and respectful, making it easy for anybody to get involved and make a difference. We have heard from several patients who have completed the surveys, and they have found it to be meaningful, and also they feel that the survey does not pose a huge burden on their time and effort in terms of the time it takes to complete the survey. But here's the phone number, the email, and there is a web link as well from our team that we have posted now that you can access. Read about our group, read about our other efforts, and also read about this follow-up study or survivorship study. So this is a multi-phase research initiative designed to understand and improve long-term outcomes. The study is currently in the enrollment phase. Since we are halfway through, I expect that we will be able to recruit about 300 participants in the next 2 to 3 years. And once that is done, we go into data analysis of all the health conditions, the psychological pain, and other outcomes. And the goal is to identify any patterns and risk factors that can inform future clinical guidelines and interventions. After the data analysis, we plan down the road, if we continue to stay funded, we plan to do a follow-up survey for all those individuals after 4 to 5 years, so that we can really track the progress or any change in their health condition based on treatments and so forth. What happened to the disease, what happened to their health, and other outcomes, and really get comprehensive information for the second step of the study. And way down the road, we really want to further go into these novel biological predictors of bad outcomes. What is causing the ECD? What is causing the health problems, various health problems, and what are the risk factors for those health problems? So really, it's a long-term study, but we hope to have some analysis presented at the ECDGA meeting or through such webinars in the next couple of years. We could not have done this without the support of ECD Global Alliance, who not only provided funding support, on top of that, person and material support is provided by ECD Global Alliance as well. They are really partners with us in this study. I'm really grateful to the ECD Global Alliance. On top of that, Leukemia and Lymphoma Society, which is renamed to Blood Cancer United now to show that it really also supports all blood cancers, such as ECD, was a key funder of these efforts as well. This is our information. And if you need flyers or additional materials to help you guide through the participation, please reach out to us. We just love to hear from patients and families in general. So if you have other questions, anything else comes to your mind, please reach out to us at this information. And we appreciate your commitment and look forward to working together. I'm very hopeful that together we'll make a difference in the ECD community, so that we don't just stop at finding the treatment for ECD, but finding the right treatment and the right type of support and tools to empower you through your survivorship phase and make sure you have a meaningful and healthy life overall.